Hello, we're going to be doing trach suctioning. I'm first going to verify my physician's order, identify my patient by asking the state name, date of birth. I'm also going to check for allergies. And you want to make sure your patient is in semi-Fowler's or Fowler's position unless contraindicated. You want to turn on the suctioning to hyperoxygenate your patient. Okay, and I'm going to wash my hands. I'm going to put on a mask and also a gown. Okay, and when I say hyperoxygenate, I'm just going to say this is my oxygen mask, and I'm going to place it where it blows over the trach. Okay, and then I'm going to wash my hands, put on gloves. I think I already said that. I'm kind of repeating myself. Wash my hands, put on face mask and gown, and I'm going to open my sterile kit. You want to open away from you, and this right here, I'm going to be careful and touch only on the outside because you don't want to contaminate the inside. The inside is sterile. I'm going to sit this right here, and I'm going to get my saline, and it's not been opened, but I want to make sure it's not expired or anything like that. It's double-sided. So what I want to do is open it and pour it in here. Okay, and once I pour that in there, and then I want to slide this here out of the way, and I'm going to grab my gloves. Careful, only touching the 1-inch borders. And I'm going to put on my dominant hand first. Okay. And I'm going to grab the other one on the inside, keeping it above my waist. And I'm going to step back, and I'm just going to keep my thumb up. Okay, now that I have on my sterile gloves, I can grab this because it's sterile. I'm gonna take this out, and I'm gonna grab this with this hand because I'm right-handed, and I'm gonna grab this with my left hand. And what I want to do is I want to connect the one that's with my non-dominant hand. So move your arm. I'm gonna grab this and wrap behind the chair. So I'm going to, with my non-dominant hand, yes, everything is sterile still. And because I'm going to have to connect this, okay, and I'm going to grab this here. And place this up in here. It's kind of hard because it's not the right tubing. Okay. And so now this has come out. Okay. Okay, so I want to then moisten the tip. And just by putting it in the saline, and then you're gonna suction up some of the fluid. Okay, so now you can go ahead and tell them to take a deep breath, and you're gonna insert this at about 5 inches. And you want to go in 5 inches, and once you go in, you want to suction. You want to rotate the catheter with the thumb and the forefinger. Do not suction for more than 10 seconds. And you're constantly doing this and rotating for 10 seconds, and then you want to take that out, and then you would put it in here. You would encourage the patient to cough and deep breathe in between suctioning. And so we're gonna go in one more time, and you're gonna rotate, insert 5 inches, rotate. And remove. Okay. I'm gonna put that in there. Okay. And once you flush it, you want to replace your oxygen source as ordered. You want to turn off the suction, and then you can discard this as appropriate once you turn it off. Okay, and now I'm going to remove this just like this. And discard in your trash. And I'm going to wash my hand, and then I'm going to oxytate and then I'm going to listen to my patient's lung sounds. Take a deep breath. Another deep breath. Deep breath. Deep breath. Deep breath. And another one. All right, and the patient is the lung sounds are better. I want to document the procedure, the observation, including the amount, the characteristics of the secretions, of the respiration before and after suctioning.